Well, Leslie, health officials say the pharmacy diluted vaccines meant for adults just one day after the CDC recommended vaccinating children 5 to 11 years old. And since then, the federal and state governments have ordered the pharmacy to stop giving COVID-19 shots. And tonight, we are learning it is now being reviewed by the State Board of Pharmacy. There's a clear difference between the Pfizer vaccine for adults and young children.
So the adult dosage is 3 times the children's dosage, 30 micrograms versus 10 micrograms.
But Director of Loudoun County Health, Dr. David Goodfriend, says Ted Pharmacy in Aldi gave the wrong dosage to more than 100 children last Wednesday and Thursday by diluting vaccines meant for adults. The pharmacy did not have the new shipment of vaccines for kids 5 to 11.
Because they were doing something that there were not instructions of how to do correctly, it's hard to be sure that the children got the exact correct dose.
It came to light after a parent whose child received the incorrect dose noticed the wrong colored cap and called health officials. The next day, both the state and feds ordered Ted Pharmacy to stop administering COVID vaccines.
So while I don't believe they had any ill intent, that they were trying to do is to provide children with COVID vaccine to keep them safe, that was something they were not authorized to do.
This week, the local health department removed the rest of its shots. Goodfriend says the only thing to question now is how effective they really were.
And if they got a little bit more, that's fine. We're not seeing any increase in side effects. But if they got too little, then the question is whether the dose was effective or not.
Now, the health department is telling parents to get in touch with their provider to determine if their child should get another shot or wait for a second dose. Now, I did speak with the pharmacist inside, and he simply could just tell me that this is a small business just trying to make it through, and that he has been busy getting in touch with parents since last week, which he was instructed to do.
Okay, Matthew, so wait a minute, let's make this clear. The pharmacist diluted the dosage. Is that allowed, or were they supposed to wait for the correct shipment?
Well, Leslie, regardless for any of the COVID Pfizer vaccine, it is instructed that providers dilute the vials before a dose is taken out. Officials are saying that what the pharmacy did as far as diluting this adult vaccines, knowing that the intention was to put into the arms of the kids, that should not have happened. Now, keep in mind, both of these Pfizer vaccines may have the same active ingredients, but they are two totally different formulations. So you can say that they could have waited for this shipment of the children's vaccine, but it is unclear whether a shipment was already in the works. Leslie.
Yeah, still a lot of questions about the dosage. Most importantly, parents need to know about these labels. So let's talk about it, because there is an easy way to verify if that vial is meant for your kids ages 5 to 11 or 12 and older. The Pfizer pediatric COVID-19 vaccine vials have orange labels or caps. They look like this. The dose for ages 12 and older has purple packaging, so you can look just to make sure that the caps in the packaging is correct. Now, we know there are a lot of questions about vaccines and boosters. If you text the word verify to 202-895-5599, we will send you a list of our latest fact checks right to your phone.